Hello everyone and welcome to another high-yield USMLE question. This is a neurology question, 57th question in the medicalized question bank. So we have a 55-year-old female presented to the office because of shaking of her right hand. The patient has no other complaints except for slowed movement. The patient has a prior history of diabetes and hypertension. Widely, the patient is stable. General physical examination is unremarkable except for an obese abdomen. CNS examination shows a tremor at rest that disappears when the patient moves their hand. So it's a resting tremor. Which of the following is the mechanism of action of the drug in this patient's tremor management? Right, so this tremor is a resting tremor. First, we have to know what kind of a tremor this is. So resting tremor usually is Parkinson's tremor. So this patient has some other feature that also suggests the tremor, the Parkinson tremor, the slowed movement. So the key points are the slowed movement and also the examination finding, the tremor finding. Tremor disappears when the patient moves their hand, and the slowed movement, both of them together makes it a Parkinson tremor. Remember, Parkinson tremor, we will discuss some pathophysiology, but you use anticholinergics for this. So our right answer is actually B. A is wrong answer. A, usually beta blockers, like propranolol is a drug of choice for essential tremor, but the essential tremor is an action tremor. It's going to actually occur when you move the hand, and usually it's bilateral. And the C is indirect GABA agonism, increased frequency of chloride channel opening. They're talking about benzodiazepine, not typically used for tremors. It's not typically used for tremors. And then indirect GABA agonism, increasing duration of chloride channel opening. Those are barbiturates. For example, primidone. Primidone is a barbiturate, and it can be used for essential tremor if propranolol is contraindicated. For example, COPD patients cannot use propranolol because of the beta blockade, because it can cause spasm of the bronchial smooth muscle. So that's why in COPD patients or asthma patients, beta blockers are not used, and in essential tremor, then you can use primidone, which is barbiturate, which increases the duration of opening of chloride channels. And the one way to remember this, the duration is barbiturates. Usually people will call it barbiturates just to know the mechanism of barbiturates. Important for step 1 and also for day 1 of step 3. Now, a little bit of the pathophysiology. Normally, let's say this big blue, this blue area here represents the basal ganglia. So normally, what happens is that you have dopamine equal to acetylcholine. They are in balance. So this is a normal brain, normal basal ganglia. Now, let's say we are now discussing a basal ganglia of a patient who has Parkinson's disease, just like this patient. So in Parkinson's disease, what happens is that the nigrostriatal pathway is degenerated, which leads to decreased dopamine in the basal ganglia. Now, when you decrease the dopamine, automatically the acetylcholine effects are exaggerated, so you have relative increase in acetylcholine. So remember, it's not like acetylcholine is produced more. It's because you have decreased dopamine, so the effects are exaggerated. It's just relative increase. Now, some features of the Parkinson's are because of increased acetylcholine, and some are because of decreased dopamine. The features that are due to increased acetylcholine are the resting tremor, the pill rolling tremor, and the rigidity. These two features are basically because of increased acetylcholine. And the main feature that is because of low dopamine in Parkinson patients is the bradykinesia. The initiation of movement is very difficult for these patients. They will say that, okay, so if I want to get up from a chair, that initial burst of movement requires a lot of dopamine. They don't have dopamine, so they can't initiate that. First movement is very hard for them. That's called bradykinesia. So that requires dopamine here, decreased dopamine, so you can get very low, slowed initiation of movement. That's why this patient has slowed movements, this patient in this question. Right, so a little bit about the tremors here. We have essential tremor, that is, remember, first of all, it's an action tremor. It's autosomal recessive. It's bilateral. So if there will be family history, it will be bilateral. The treatment drug of choice is propranolol, but you can use primidone if contraindicated. Propranolol is contraindicated. The second tremor is cerebellar tremor. Remember, it's also action tremor. But we have to know how to then differentiate essential from cerebellum, because both are action tremors. So in the question, usually for cerebellum, they will give you some other features of cerebellar dysfunction, like ataxia, like nystagmus, dysarthrokinesia, dysmetria, for example. So, but other feature, if they only want you to differentiate based on the tremor quality, it's that in essential tremor, the tremor is exaggerated from the beginning. For example, let's say this is the target. We put a pencil or whatever as a target. You tell the patient to reach out to it. If it's uniform in frequency, just from the beginning, it is getting exaggerated. And as soon as it reaches the target, it doesn't exaggerate that much. They're talking about essential tremor. If initially it's okay, but as soon as it reaches the target and then it gets exaggerated, then that is cerebellar tremor. So that's the quality, how you can, based on just the quality of tremor, you can differentiate essential from cerebellar tremor. Then with the Parkinson's, which is resting pill rolling tremor, and you're going to use anticholinergic for treatment like benztropine and trihexyphenidyl. And then with the physiologic, as the name indicates, it's a normal tremor that we all have, but usually, also remember, it's the most common cause of action tremor. It's not noticeable normally, but when you are tense or you have a lot of caffeine, or if you're hyperthyroid, it can become exaggerated, and then you get the bilateral action tremor which is physiologic. Normally not noticeable. So this was all about the tremors. Hope this video was helpful. If you like the channel, make sure to subscribe and like the video. Also, there is you can support the channel. Link will be in the description. You can buy my Step 2 CK high yield notes as well there. Thank you for watching.